nursing student from LPU St. Cabrini School of Health Sciences. So today, I want you guys to learn something new from me because I will be doing a return demonstration about taking a general survey and vital signs. But first, let us talk about what general survey is. A general survey is an overall review or first impression a nurse has of a person's well-being. General surveying is visual observation and encompasses the following: appearance, body structure, and behavior.
First, you must perform a hand hygiene. And don't forget to provide privacy, close the door, as well as the curtains.
Good day. Hi, Miss Marielle. How are you? And how's everything going for you today?
I'm fine.
Okay. So my name is Aliyah and I will be your nurse for today. So I'm here to do a general survey, just checking up on you because this is what nurses do, especially in the first contact with their patient. Is that okay with you?
Yes.
I have just a few routine questions I need to ask. They will help me to take the best care of you that I can. Okay? So can you tell me what day of the week it is? Or what I mean is, what day is today?
Tuesday.
Okay, can you tell me your full name?
Marielle Vergara.
Okay, how about your birthday?
May 20, 2000.
Okay. Your age?
19.
Okay. Great, can you tell me where you are?
At hospital.
Okay. Wonderful. Can you tell me what date is today?
April 13, 2020.
Okay. So I can see my patient is alert and oriented because she answers my questions correctly.
My patient's facial features is symmetric. No any signs of acute distress such as shortness of breath, pain, or anxiousness. My patient's height and weight appear within normal range. The body fat is evenly distributed, and my patient's posture erect and appropriate for her age. My patient's gait smooth, even, well-balanced, and coordinated. And my patient's joint mobility is smooth and coordinated with a general full range of motion.
So for now, I will be asking you to do something so that this will also help me to observe more about you. Okay? Can you close your eyes? Okay, and then open up. Okay. Can you smile for me? Okay. Can you tell me what is this?
A wristwatch.
Okay. Can you tell me what color I'm wearing?
Gray.
Okay. Okay, that would be great. So now, all you have to do is repeat what the word I am saying. Okay? Okay, let's proceed. Brilliant.
Brilliant.
Lovely.
Lovely.
Adorable.
Adorable.
So in here, I can see that the patient's facial expression is relaxed and the patient's speech is clear and it is normal state or condition. Okay?
My patient clothing is appropriate for climate, fit well, and appear clean. No bad odor and no bad breath.
Did you find hard to do all what I'm asking you to do?
No.
So now let us proceed with your height and weight. So in here, I have an improvised stadiometer for your height and I have a scale or balance which is a device to measure your weight. So ma'am, we are now done getting your height and weight. And your height is 5'4" or 64 inches. And your weight is 49 kilograms or 108 pounds, which is normal for your height.
Using the tape measure, measure the patient's waist circumference. And my patient's waistline is 29 inches.
So, what temperature entails? The temperature is the specific degree of the hotness or coldness of the body. It is usually measured with a thermometer. And now, let us talk about the purpose of checking the temperature. First, the measurement of body temperature can help detect illness. Second, it can also monitor whether or not treatment is working. Good day! I am Ania, your nurse for today, and I will be taking your vital signs with your temperature, pulse, and of course the respiratory rate. And I will be asking some questions to verify your profile. Is that okay with you? Okay, your name is?
Maria.
Okay, how old are you?
19.
Okay, you're 19 years old. Alright, thank you. All you have to do is just relax. And if you have any question, please don't hesitate to ask me. Okay, I have my digital thermometer here. And I will get some cotton balls. Then I will pour alcohol with it for me to clean that thermometer. Then I will place the tip of my digital thermometer in the center of my patient's armpit. And then keep arm tight against side of the chest. Since I am using a digital thermometer, I will wait for the beep sound for the signal that I will be going to remove the thermometer from my patient's armpit. Okay, and then remove the thermometer. Mom, your temperature is 36.2 degrees Celsius. Then after that, don't forget to clean the thermometer, get some cotton balls, and pour an alcohol with it, and clean the thermometer. And then after cleaning the thermometer, I will document the result. Okay? So, what pulse rate entails? The pulse rate is a measurement of the heart rate. This is the number of times the heart beats per minute. And now, let us talk about the purpose of checking the pulse rate. First, to see how well the heart is working or pumping enough blood. Second, it helps find the cause of symptoms such as irregular or rapid heartbeat or palpitations, dizziness, fainting, chest pain, or shortness of breath. So, what respiration rate entails? The respiration rate is the number of breaths you take each minute. The rate is usually measured when you are at rest. And now, let us talk about the purpose of checking the respiration rate. First, it is to assess and note whether the client have any trouble with breathing. Second, to keep the balance of oxygen and carbon dioxide intake. So now, I will be checking my patient's heart rate using the radial pulse. And then, the patient's arm position is alongside of the body. And then we must need to find the groove of patient's wrist, which is on the thumb side. And then lightly place the first 2 fingers, or you can use your 3 fingers, over radial artery. Do not apply much pressure, okay? So you will not obstruct the pulse. In here, we must wear a wristwatch. Okay. With second hand, not a digital watch, okay? And then count the patient pulse for 30 seconds and multiply by 2. So ma'am, I have also checked your respiratory rate, but then I did not tell you that I will be checking it for you to not feel conscious and for you to not make a change with your breathing. Okay ma'am, your heart rate was 82 beats per minute and it is normal. And for my patient's respiratory rate, it was 16 beats per minute. So in here, I will record all the results and report any abnormal findings to the healthcare provider. So, what blood pressure entails? Blood pressure is taken using 2 measurements. Systolic, measured when the heart beats when blood pressure is at its highest, and diastolic, measured between heartbeats when blood pressure is at its lowest. And now, let us talk about the purpose of checking blood pressure. First, it is a tool doctors use to help identify if a person is at risk for heart disease or stroke. Second, keep in mind, it is not only tool, and it doesn't necessarily indicate that a person will or won't have heart disease. But it does help doctors in the management of their patients' care.
So at first, we need to check the order of the doctor.
Hello ma'am. Good day, this is Aliyah, your nurse for today. May I ask how are you feeling today?
I'm fine.
Okay. Next, we need to gather our equipment and check if everything's fine. So I have here my aneroid sphygmomanometer and the stethoscope. And I have also here an alcohol and a cotton balls. Is this patient Marielle, for whom the doctor ordered to check the blood pressure? Okay, and hello ma'am, I am here to check your blood pressure and I have here my sphygmomanometer kit. Okay, don't think it too much and just relax. And then next, I will assist my patient to give her a more comfortable position. And then apply the blood pressure cuff with 1 to 2 inches above the brachial artery. And then, clean the earpieces of your stethoscope as well as the diaphragm using a cotton ball and then pour an alcohol with it. And then clean it. But first, you must need to locate the patient's brachial artery, which is located in here. And then, tighten valve on hand bulb And then, inflate the cup while filling on the artery to the point that you will no longer feel the artery of your patient, which is about 80 mmHg. And this is my patient's estimated systolic number. And then, place the earpieces of your stethoscope in your ears, of course. And then place the diaphragm head of the stethoscope over the brachial artery. And then tighten again the valve on the hand valve. And then pump hand valve. And then add 30 mmHg to the patient's estimated systolic number. Release valve. Slowly, okay? Listen for the carotid cough sounds. Note pressure at point where you first hear the regular sound, which is your systolic number. And note pressure at point of muffling and point at which sound disappears, which is your diastole. And then, if you want to double check it, just wait for 2 minutes if necessary. Then remove the earpieces. And then next, remove the handcuff from your patient. And then, after doing the procedure, you must clean the earpieces of your stethoscope as well as the diaphragm using a cotton ball. Then pour an alcohol with it and then clean it.
And at the end of the procedure, don't forget to perform a hand hygiene, okay?
For the evaluation, the blood pressure is within normal limits of my patient age and her usual blood pressure. Then after that, document appropriately, including the narrative as necessary. Then report any abnormality to the appropriate person. And yes, we are finally done. I hope you already knew the importance of taking a general survey and vital signs. I hope to see you next time in my another return demonstration. Once again, this is Aliyah Piayaras, a nursing student from LPU St. Cabrini School of Health Sciences. Thank you for watching! Bye!